Imagine a world where mental health isn't a taboo, but a topic we all understand and embrace. To get there, we need to mitigate stigma and boost mental health literacy for everyone, regardless of where they come from or their background. Cultural competence is key, ensuring our approaches respect and celebrate diverse perspectives, while family engagement campaigns help create supportive environments right now. We can adopt step care intervention models starting with simple, accessible support like psychological counseling and education, and stepping up to more specialized treatments like structured psychotherapy and pharmacotherapy when needed. Mental health education outreach and capacity building approaches, especially through digital platforms, make these resources more accessible than ever. It's not just about individual care, we need integrated strategies that consider the bigger picture. Factors like food security, housing regeneration programs, and green and blue spaces, which promote mental health in urban and rural areas. Addressing social determinants such as adversity, migration, ethno-racial issues, and social isolation help us tackle the root cause of mental health challenges. Understanding the epidemiological characteristics of mental health conditions enable us to craft preventive approaches like school-based program parenting interventions and community outreach that build resilience from a young age. We should also recognize the unique experience of different genders, ethnic densities, and social contexts. On the neuroscience front, we're learning that brain plasticity, neurodevelopment, and areas like the hippocampus and parietal cortex play crucial roles in mental health. Concepts like mental imagery, whether it's sensory compensation, internal imagery, or maladaptive daydreaming, show us how our brains encode memories and process sensory information across multiple modalities. From bodily sensations to visual, auditory, olfactory, gustatory, and kinesthetic experiences. Sometimes mental health issues manifest social phobia, pathological emotions, or even psychosis, often exacerbated by social isolation, discrimination, or marginalization. Addressing these requires not just clinical intervention, but also efforts to enhance emotional intelligence, foster an intuitive understanding of ourselves and others, and promote a growth mindset. The journey isn't without hurdles. Mental health professionals often face challenges like low wages, documentation burdens, poor infrastructure, and limited career development. The trauma of working in high stress environments. We must also be vigilant about coercive practices like involuntary medication, seclusion, or compulsory admission that can be more harm than good. Finally, social prescribing offers a gentle, community centered approach like individuals to activities and support networks that nurture mental well-being. By weaving together these various threads, scientific insights, social strategies, and compassionate care, we can foster a healthier, more resilient society where mental health is a shared priority and everyone has the opportunity to thrive.